Next, we have reflection on the intergenerational impacts of community violence with Ms. Ella Green Moten. Ella has an extensive background in public health advocacy, public health policy, community-based participatory research, known as CBPR, and programming spanning over the past 40 plus years in the city of Flint and the surrounding areas. In addition, she has specific efforts in public health ethics. She is focused on providing an awareness at the community level, developing and elevating the community voice, and advocating for community inclusiveness at the state and national levels. Her areas of expertise include facilitating community, academic, and practice partnership by building through building and sustainability, developing, managing, and evaluating community-based projects and training programs for graduate students, community members, as well as middle and high school students, partnering with community-based organizations, schools, and public health agencies. Ella serves as the immediate past Michigan affiliate representative for the governing council known as ARGC. She is a member of the community-based public health caucus known as CBPH, and is a member of the National Community-Based Organization Network known as NCBON, and the All-American Public Health known as APHA, as well as the newly elected 2022 president-elect of APHA. She is also an HB-Flint CAB member, and we're so lucky to have her here. Without further ado, Ms. Ella Green Moten. Oh, I think you're on mute.
I am. Thank you so much. And I am excited to be here as well, and especially being able to hear all of the presentations earlier that just solidified the information that I will be sharing today. Next slide, please. So today, I want to talk about the intergenerational impacts of community violence. And as is my process, when I talk about a subject, I like to start with getting an understanding of the terms used in the subject. So I'm going to start there. Next slide, please. So when we think about intergenerational impacts, we're talking about the of a traumatic event on descendants who didn't directly experience the event. Next slide, please. And understanding that these impacts go beyond the individual's psychological and also act at the family, social, and cultural level. And in addition to psychosocial effects, they are neurobiology and genetic effects. And also intergenerational mobility is another approach that describes how parents and offspring's income and education are related to each other. Next slide, please. And just to drive home the point, we've talked a little bit, and you've heard a little bit this morning about intergenerational impacts and how it plays out in the community. Intergenerational cycles of violence occur when violence is passed from parent to child or sibling to sibling. And this clip art, I found and thought it really didn't need words, but it definitely shows how acts of violence can be passed from one generation to the other. And if you'll notice very carefully, you don't see anything happening to a sibling, but you see the child with thoughts of doing something to the teddy bear. Children exposed to domestic violence are likely to develop behavioral problems such as regressing, exhibiting out of control behavior, and emanating behaviors. Children of violent offenders are more likely to become violent due to intergenerational transmission. Some of the prominent theories include social learning, genetics, official bias, and the transmission of risk factors. Community violence is the exposure to intentional acts of interpersonal violence committed by individuals who are not intimately related to the victim. Next slide, please. Also, clarifying questions about community violence might be, where does it happen? How does it look? And who does it impact? It can happen in public places, such as schools, streets, and neighborhoods. It may involve assaults, shootings, fights, gangs, and other forms of social disorder. And it affects all of us, but especially youth and young adults and people of color who face more poverty, racism, and the lack of opportunity. Community violence can also be motivated by prejudice related to race, ethnicity, religion, gender, disability, sexual orientation, or gender identity. Recognizing that it usually occurs without warning and causes trauma and harm. And this information came actually from the violence prevention at CDC. And I also found some interesting information from Dr. Karen Francis, who is the vice president and chief of the DEI and DEI officer of an organization called AIR. And I'm going to apologize to you. I looked and looked and looked and could not find out what AIR stands for. So I'll have to get back with you on that. But they've done some awesome work on trying to understand how this connects. Next slide, please. And I love word clouds. And I saw this, and it actually speaks to all of the things that can happen in a community. And many of these are could be violent acts. Sometimes violent is very in your face, and sometimes it's very subtle. And what I'd like to do is just have you take a look at these. You might not be able to see all of these words clearly, but I just highlighted a couple of them that I'll read about: harm, bullying, family, fear, guns, crime, abuse, abusive, and humiliation. And the word humiliation stood out to me because when we talk about violence, sometimes we don't think about the subtle acts of violence. And I want to lift this example of violence because it was just amazing when I heard it. Some of you might know that my son is in education, and years ago he served as head of schools in one of the largest cities in the States. And one of his teachers mentioned to him that, in her opinion, the only way to get the attention of a young person was to humiliate them. And I couldn't believe I was hearing that. I know all kinds of folk are in all kinds of positions, but that was a very hurtful thing because it made me think about how long she might have carried that notion, how many times she might have acted out on that thought, and how many children might have been damaged by that thought or whatever her action might have been thinking in that vein. But this is to raise the awareness. We talked a little bit about that earlier, but the awareness of what violence can look like and how it can be carried from generation to generation. Next slide, please. And I wanted to say a little bit about trauma because it's hard to talk about intergenerational impact of community violence without talking about trauma. You've heard the word trauma and traumatic effects used a lot today. So, again, I wanted to give you a definition, something to hang your hat on. Trauma is an emotional wound resulting from a shocking event or multiple or repeated life-threatening and or extremely frightening experiences that cause lasting negative effects on a person, disrupting the path of healthy physical, emotional, spiritual, and intellectual development. And I pulled this information from the Children and Trauma in America, a report of the National Child Traumatic Stress Network, which was done back in 2000. Next slide, please. So remembering that trauma in many cases is an emotional response that is caused by experiencing a single incident of a series of distressing or traumatic emotional or psychological events or both. As in a moment of reflection, I want you to think in terms of the fact that even a basic understanding of intergenerational impact of community violence has to begin with an initial awareness. And I'll be the first to admit my awareness was very low on exactly how we should be thinking about the intergenerational path, because it's clearly there in so many different areas. And I want to encourage, as I reflect on what it means to me and how I might have seen it and didn't recognize it, or even in some cases recognized it and did nothing about it. I want us as elders in our community to put on our elder hats and start to recognize and own some of these things and find ways to do something about them. It's not an easy fix. Sometimes it's just about having a conversation about what you see or asking questions about what you thought you saw. Next slide, please. So this is an invitation for reflective thinking for all of you. It doesn't have to be an open conversation, but just start thinking about what did I learn from this information today, from all of the other speakers and from my talk that I didn't know before this presentation. What links can I make between my community experience and today's presentation? How can I use this information in the future to make things better in my community, to curb the level of violence in my community, to help folk who might not be able to help themselves, or to even just start having small conversations, help people understand what they're actually seeing or what they're experiencing. I ask you to consider this. I ask you to make it a personal thought or personal plan of action that you might take on, so that we all might be able to work and understand it more, but better than that, understand that it does exist and that it has existed for generations. And if we don't do something about it, it will continue to exist. And as a closing point, I wanted to share this with you. Like that violence holds victims, families, and friends, and entire neighborhoods hostage, causing paralyzing fear and trauma that is ongoing. Community violence is everyone's business because not a single person in a community is left unaffected by the effects that violence leaves behind. Community violence can be reduced and or prevented. We can take action to improve the lives of those who have survived violence. There are many factors that contribute to violence, ranging from individual, relationship, community, and societal. But it's clear that solutions must address all of these factors.